The Ron Ponder Show. News Talk 1480, WHBC.
Right now, I want to turn our attention to healthcare. As I said earlier, there's a lot of information about healthcare in the news. Some of the information is, in fact, most of the information is politically oriented. It depends on who's giving the information, what position they have. I was watching Fox News not too long ago. They had about 6 people on there who were claiming that they've been thrown out of their healthcare, that their policies are no longer valid, that their premiums have gone up. And then CNN comes back, re-interviews those people, and finds out that they weren't doing something right. Where is all of this confusion going? Well, we'll have to find that out. But in the meantime, what we want to know today is the current status of healthcare in America and how it impacts you, the listeners. We've got callers calling in already. Peggy, I know you're there. You're going to be the first caller we come to when we can come to you, callers. But first, let's reintroduce you to Mike Novelli. He's the Vice President, Reform Implementation, darn big title, for AultCare. Mike, welcome to our show.
Good morning, Ron. Thanks for having me.
Mike, I don't even know where to start. There is just, we talk about the website, talk about the benefits, talk about the subsidies. I'll let you start where you want to start.
Okay, let's start with Healthcare.gov, because obviously the central piece of people getting insurance in 2014 revolves around Healthcare.gov.
Which is a website. Absolutely. You go to www.healthcare.gov, and that's where the process starts for you to begin the enrollment and then select a plan and then receive confirmation that you have a plan, along with calculating any help with premiums that you might be eligible for as a result of your family's income. Now, the website it's well documented that the website is not working very well. There was a published report yesterday that about 50,000 Americans have enrolled to date on healthcare.gov. The initial estimates were that they expected that about 7 million people would enroll. Close.
So we still have a long way to go. AultCare is offered on the marketplace at healthcare.gov, and to date, since October 1st, we've actually received 34 enrollments for people in Stark and Carroll and Tusk counties.
How relative is that? Is that a lot? Is that not a lot, or what?
Well, when we compare it to the numbers, about 1,000 people in each state have enrolled. And when we compare our 34 to 1,000 in the state of Ohio, we think that we've got our fair share of that 1,000, but we're still really far short of our goals and our expectations of the number of people who need insurance and will enroll through healthcare.gov.
Okay. Now, assuming there's somebody out there who has a lot of questions, they don't have health care, they want to upgrade their health care, they go to the website, it doesn't work, what should they do then?
Well, there's a couple options. First of all, there is a toll-free line for them to call that is posted on healthcare.gov, and they do answer the phone. I've spoken to those people.
A live person.
There is also live chat. I was sharing with you before we came on the air that I had a live chat this morning with a person at healthcare.gov. So they are trying to provide help. Now, the people in the customer service area and the live chat area have a difficult job because people are usually contacting them because they're unable to get logged on to the website. So basically what they end up telling people is they're working around the clock to get healthcare.gov fixed. And, it's going to get fixed.
I was going to ask you that. That was going to be my next question. Is it going to get fixed?
The president appointed Jeffrey Zaintz, who was a guy who was supposed to create a lot of efficiencies in the White House, and he appointed Jeffrey to take over healthcare.gov and get all of these systems talking to each other and working. And he made a commitment that by the end of November, the system would be working. But again, there's rumblings that there are so many problems that may not even be working at the end of November. So the time crunch to get everyone enrolled is becoming critical. So I think there's so much expectation that it has to work, that something is going to change to make it work, or they're going to have a workaround for people to get enrolled.
Now, there are deadlines coming up, though, right? Hard deadlines that if they can't get enrolled by, or they have to be enrolled by a certain time, in order for their benefits to kick in, what deadlines are approaching?
That's correct, Ron. By December 15th, a person has to be enrolled in a plan through healthcare.gov or by phone or through paper application in order for their coverage to take effect on January 1st. That's the way the rules are written for entry into the marketplace plan. So AultCare would receive an application by December 15th for that January 1 effective date. And it rolls forward every month. You have to be enrolled by January 15th to have an effective date of February 1st. So you can see today is November 13th, we've got 32 days to enroll over 6 million people. The time crunch is just getting greater and greater as we move forward.
We're talking with Mike Novelli. He is, let me see your card again because I can't remember this long title, Vice President Reform Implementation for AultCare. And Mike, let's assume that all this is going to be fixed. Do you think, first of all, I should say, do you think the website's going to be fixed, and do you think that people are going to be able to enroll, deadlines notwithstanding?
Yes, I believe that it's going to be fixed. It has to be fixed. The reputation of the government is on the line here. There are millions of Americans depending upon the website to work so they can get the insurance that was promised with the Affordable Care Act. So I feel confident that's going to get fixed. I can't tell you a date, though. I'm not confident about being able to prognosticate that date. But I also think that there will be some accommodation. They'll be forced to make some accommodation if it's not fixed in time for people to get enrolled January 1. I don't know what that accommodation will be, but there are bills in Congress now that people are already setting the stage for some accommodations to take place for people who can't get enrolled because the website is not working.
Right. Mike Novelli, he's one of the vice presidents at AultCare. In fact, he's vice president for reform implementation. And when I have questions about healthcare, I go directly to Mike because he has most of the answers. I don't think anybody has all the answers, but Mike has most of the answers.
Hi, Ron. I just have a few questions about my son. He's presently under our healthcare, which we have AultCare, and it's great. But he has a preexisting condition. He is a substitute teacher, and he is going to turn 27 in June. So he will not have a healthcare. So do we wait to sign him up when he turns 27, or do we sign him up now? And his medications are like $1,000 a month.
Wow.
And he has to go to specialists, and so like sometimes they will make restrictions. If it's not network, if the physician's not network, they won't pay. And so I was wondering how that will all work. So should I wait to sign him up, because he has been advised to be signed up, but he's presently under my husband's health care.
Through his job, right?
Yeah, through his job.
Okay.
So that's my question.
Okay, thank you, Peggy, and we'll get you an answer, okay?
All right.
Mike, that's a long question. You got time to answer it in 1 minute, or you want to wait till after the news?
Well, we can wait till after the news, Ron, but there will be some solutions for her. She'll actually have two options. So I think we can wait till after the news, and I'll go through those in detail of what their options are. But there's a lot of good news for her based around the Affordable Care Act.
Good. I'm sure Peggy is, if she's at home sitting there listening to us, she's happy to hear that.
Great.
And there may be some other folks in the same situation as Peggy and her son regarding health care. And there may be some of you who have other situations. If you've got questions that you'd like answered from a professional, not from a political point of view, but from a professional point of view about your health care or the health care of a member of your family, feel free. Give us a call at 330-450-1480. Mike, do you have an answer for Peggy?
Sure. For Peggy's son, he has two options, really. First of all, one of the main things in the law is that no one can be denied a claim or entrance on a health plan beginning January 1, 2014, because of a pre-existing condition. So her son doesn't have to worry about any conditions that he has when he goes to apply for insurance. In fact, insurance companies beginning in 2014 can't even ask people if they have any health conditions. The way the pricing is going to work in 2014 is it's going to be simply age-driven. So let's take a 27-year-old like her son. Every 27-year-old in Stark County that buys a policy will pay the same rate from an insurance company. For instance, let's say he decides to buy AultCare. Regardless of his health status, that 27-year-old will pay the same rate. I use the example when I give talks about it, that you could have a marathon runner that's a 27-year-old, and you could have an extremely ill 27-year-old that has type 2 diabetes and many comorbidities. Those two 27-year-olds will pay the exact same amount. Now let's get to her question about when he should join. Really, that's a decision that they should make based upon information they gather. He can go online if he can, or apply in person, or apply by phone. He can find out what the cost of insurance beginning in January will be and compare that to what it costs him to be on his father's plan. I would guess that his father's plan is probably going to be his best alternative until June. When his policy expires in June with his father, he is allowed by law to go out and shop on healthcare.gov. So surely it'll be working by June, so they'll be able to go out there and find out what the cost of a policy is. But he's guaranteed to be able to buy a new policy when he gets off his father's plan in June.
Okay. Mike Novelli, he's the Vice President of Reform Implementation for AultCare, answering the question that one of our callers, Peggy, posed to him. And I'll say this, too. If you've got questions, give us a call at 330-450-1480. The last time, I was telling Mike, the last time he was here, we talked about healthcare, and we posted his interview on WHBC.com, our website. It had more hits than almost anything else on our website. If you're missing this now, or if you know somebody might want to catch it later on, just tell them to go to our website, WHBC.com, and they can catch up to it. And Mike, we talked about some of the problems of the website. We talked about some of the problems in terms of the policies themselves. But what are some of the things that are changing now? What can people select now? What can they do now in terms of getting themselves health care?
Well, again, I think that what people need to do is educate themselves about what it is that's happening out there. You've heard that the premiums are going up. It gets a lot of publicity, and it's true because of the design of the plans and the fact that we're accepting all people regardless of their health condition. The price of insurance is rising. But along with that, people in certain income levels are eligible to get premium assistance from the federal government. So I think that one of the things that people can do, absent of being able to buy a policy, is to go to a website, excellent website. It's the Kaiser Family Foundation. It's a nonprofit organization that really works hard to educate Americans about health insurance.
Kaiser Family.
Kaiser Family. The website address is kff.org. And if you go to kff.org, on their front page, there's something called a subsidy calculator. And what you have to do is you have to pick the state you live in, you have to give the birth dates of all your family members that are seeking coverage, and you have to estimate your family's household income. And once you do that, the Kaiser Family Foundation gives you an estimate of how much your premium is going to cost and how much of a subsidy that you will receive from the federal government to assist you in purchasing coverage. I can use an example that I know off the top of my head because I do it in presentations. Take two 55-year-old adults, a male and a female, that would go out and let's say they make $50,000. Well, they would have a premium of about $800 a month for coverage through the marketplace
for
plans,
both of them.
For both of them combined. But at $50,000, they would also be eligible for about $400 in premium assistance from the federal government. So their net cost would be $400. And these subsidies are paid directly to AultCare when you buy that AultCare plan from the federal government. So that those two individuals, 55, would send AultCare a check for about $400, and the federal government monthly will send AultCare a check for $400. So in combination, we have that premium payment, and those two people would have coverage beginning in 2014.
Would it be adequate coverage? Because some of the coverage, some of the plans I've seen, they got the Cadillac plan, they got the Silver plan. Are those plans adequate?
Well, I think each consumer has to decide what is adequate for them. If you're somebody who consumes a lot of health care, if you go to the doctor a lot, you'll probably end up wanting to gravitate to a gold plan or a platinum plan if it's available in your area. And we've talked about those before, but just to refresh your listeners' memories is that there are 4 categories of plans: bronze, silver, gold, and platinum. The bronze plan covers about 60% of the cost of medical care for individuals. The platinum plan covers about 90%. So the bronze plans are the most expensive. The bronze plans are the least expensive. The platinum plans are the most expensive, and the silver and gold fall in between. What it's going to be important for consumers to do when they're shopping for insurance, either online or by using a broker to help them understand what they're looking at, is they look at the various coverages. There's information about what exactly is provided in coverage, and make sure that that coverage fits their needs. No different than when you buy auto insurance or homeowner insurance. You need to make sure you understand what the coverage is that you're buying.
Okay, Mike Novelli, he's from AultCare. He's helping us understand this maze of insurance. And Mike, you mentioned KFF.org, the Kaiser Family Foundation's website. I've heard other folks talk about that as well. Ponder. We've only got 4 minutes left before we have to get out of the way of Dennis Miller. So I want to talk again to Mike Novelli. Mike is still here. He's our healthcare expert. One quick question, Mike. There's so many things to talk about. Fortunately, we covered a lot of territory. But what about these cancellation letters that people are getting about their present healthcare coverage? Can you quickly talk about that?
A great question, Ron, because the media has covered this a lot extensively. And I think California is a good example, because California, there were literally hundreds of thousands of cancellation notices issued in California for policies. And I think the origin of that is that California passed a law that said that every health plan and every policy had to comply with the Affordable Care Act on January 1, 2014. In Ohio, we didn't pass that kind of law, so people's policies actually expire at the end of their policy term date. So if you bought a policy, for instance, on November 1, 2013 from AultCare, your policy is not going to expire until October 31st, 2014. So I think that's why you're not hearing about these policy cancellations in Ohio. And in fact, what most insurance companies are doing are upgrading policies in 2014 to comply with the law. They are required in 2014 to make those policy changes that are outlined in the Affordable Care Act. But I think the cancellations occurred in those states like California because policies had to end before their policy end date that was written in the policy.
Right, gotcha. We've got 45 seconds. I've got a very complex question for you. Okay. In that short time. Is this going to work, Mike?
Ron, I think it has to work. I think first of all, remember this, that the goal of the Affordable Care Act when we started out was to provide coverage for every American. The estimate's somewhere between 40 and 50 million Americans without coverage. As a country, unacceptable. And this is designed to provide that avenue so that, first of all, people with preexisting conditions, as we talked about earlier, will have coverage, and every American will have an avenue, whether it's through Medicaid expansion or whether it's through purchasing a policy on healthcare.gov.
Can you come back?
I sure can.
We got to bring you back because there's still more questions that I'd like to ask you. Mike Novelli from AultCare, Vice President Reform Implementation.
The Ron Ponder Show, weekdays on News Talk 1480 WHBC.